let's go over the multidisciplinary healthcare team. So to get started, we need to know that an effective teamwork is now globally recognized as an essential tool for constructing a more effective and patient-centered healthcare delivery system. So where a lot of deliveries are felt to be made, a healthcare team is always necessary to make sure that these are delivered. Remember, when you're talking about a team, this is a coming together of two or more people for a common goal. So a multidisciplinary healthcare team is made up of two or more professionals. They can be from the same organization or different organizations, just all come together to make sure that they achieve a common goal. So the nature of a team is can be different, and also other teams can be complex. So, though many patients may think that the most effective team is a multidisciplinary team, however, teams may be drawn from a single professional group. There are different teams that can be made, even though it is not just from a multidisciplinary team. So, now let's get to understand some terms. What is the meaning of a team? So, as we are seeing, a team is a group of individuals with complementary skills. So one word that is important is a group of people or individuals. Now these are not just common people, but they've got so they've got complementary knowledge and skills. So this knowledge and the skills that they have is necessary to help them to achieve what they want. Because if you want to make an effective team, you shouldn't have only people with the same skill. Imagine everyone is a doctor. Who is going to be helping in terms of the work of a nurse? So a group of people with complementary knowledge and skills will come together for a common purpose. Okay. And at the end, they are going to make sure that apart from this common purpose we're talking about, they are also going to make sure that they are held responsible or accountable. So they are accountable for their work. If something is not seen, you get to ask this one, why is this not done? So that is a team. Now let's look at a team-based healthcare. What is team-based healthcare? So when we're talking about team-based healthcare, this is simply the provision of health services to individuals. So provision of health services, that is team-based healthcare. Now this provision of health services can be to individuals, families, or even the community, but at least to health providers who work collaboratively with patients and their caregivers. So you have got this team, there should be at least two health caregivers who are going to make sure that they work together with other caregivers to be able to provide healthcare services. So to the extent preferred by each patient, you are doing this not from what you want, but to the extent that the patient prefers. For example, if the patient prefers that you don't do the surgery, well, get to follow that. So that is what we call team-based healthcare. So the incomparison of responsibilities with accountability between team members in healthcare system offers great benefit. When it comes to healthcare teams, there is need for incomparison of accountability. As people get to work, you need to be accountable. So accountability is one important word. What does it mean? So each one is going to be held responsible, and each one has to explain the course of action. So if you get to do this, why have you done it? What value or effect does it have on the patient? Is it necessary? So you get to account for that. So for example, we can talk of poor communication between healthcare professionals, patients, their caregivers. This has emerged and it is a common practice now. There is poor communication, so because of this there is need for shared responsibility. Like others couldn't manage just doing everything. Healthcare members or professionals could not manage, and they cannot manage taking care of everything absolutely. That is why it is necessary to be in a team, so that there will be shared responsibilities, and people are going to be able to be accountable for what they're supposed to do, because you are not supposed to do everything. So if you have only a role to play and you fail to do it, then you should be able to speak why you failed to do that. So there are some medical errors and other events that can occur due to inadequacy of communication among team members, even in a well coherent team. There are some errors that can occur. That is why a team is necessary. Moreover, lack of purpose team care can also lead to unnecessary waste. Therefore, identifying of best practices may help avoid some of these dangers and may control costs. So a team is necessary because there are a lot of errors that can come. There are a lot of costs that can arise when there is no proper team to make sure that they oversee everything that is happening. Now, let's look at an effective team. So, what is an effective team and why is an effective team important? So, an effective team is one where the team members, including the patients, communicate with each other. So, all team members communicate. Not only the team members, but also the patients. So, that is what we call as an effective team. Effective means working. So, for something to be working, there's supposed to be communication. So apart from just communicating, there's supposed to be also the observations, expertise, decision making responsibilities to make sure that there is optimization of the patient's care. So there are different expertise that come together to have an effective team. So these expertise come to make sure that they observe and make decisions to just make sure that there is optimum service delivered for the healthcare system. So understanding the culture of the workplace and its impact on team dynamics and functioning will make team members a good team player. So you need to understand the culture of the workplace and also the impact on team dynamics. So in which environment are you working? Because there are some things that can be understood or some things that can be done only in some places. So as you get to pay attention to the culture of the place where the team is operating, that is going to make sure that even the operation of the team and the functions of the team members are going to make sure that they get to play their role properly. For example, in some places where it is outside the culture just to get to remove blood. So even as an effective team, it will be very, very difficult to work in such an environment when you want to give blood for someone who is suffering from a certain disease. That is because it is outside the culture of such a place. Alright, so that is basically about a team and also team-based healthcare. Now let's get to understand what's the importance. So nowadays patients rarely are rarely looked after by just health professionals. So that is why there is need for a team. So we are now considering what is the importance of a team. You know, it has been it's we've seen this. It always happens. You find that instead of health practitioners, nurses getting to take care of the patients, they are shouting at them. They are reacting badly on them. So nowadays patients are really looked after by just one health professional. So instead of just the nurse having the responsibility of taking care of the patient. It is not just a nurse who will be able to take care of the patients. So there are a lot more. So in the context of a complex healthcare system, an effective teamwork is essential for patient safety as it maximizes adverse events caused by miscommunication with other caring for the patient and misunderstanding of roles and responsibilities. So patients are undoubtedly interested in their own care and must be part of the communication process too. Their early and throughout involvement has been also known to minimize errors and potential adverse events. So the importance of a healthcare team, remember when we're talking about a healthcare team, it has to do with all health professionals. Of course, even the involvement of patients. So it makes sure that there is proper delivery. There is avoidance of mistakes that can get to happen. There is involvement of everyone. And when everyone is involved, there is a minimization of error. That is one important thing. Because if a lot of people are involved, it will not be something that is very heavy on just one person to get to do. For example, y- the nurse is supposed to maybe get to clean, supposed to attend to the patient, supposed to give the patient food, supposed to do this. So if there is a lot of things for one person to do, there can be frustration, and frustration can lead to errors. So the importance of a team, multidisciplinary team, is that it is going to minimize those errors because there will be shared responsibility. Instead of just one person getting to do everything, everyone is going to be responsible. So that gets to minimize these errors. Now, let's get to look at the evolution of healthcare terms. So, when we are talking about the evolution of healthcare teams, how does it come about, or why did it come about? Why a multidisciplinary healthcare team? What is the why is it there? What is it supposed to do, and how did it start? So, the evolution of patient care, how it all started. So, one all-knowing physician or a private nurse living in the community in the good old days cared for people, and either was very easy to approach when needed at times of the day. So, in the olden days, a good old day, a nurse and any just health practitioner cared for patients. Now, it is not anymore like that, or it wasn't seen as anymore to be like that. So healthcare has changed enormously since then, when more rapid pace in the last 20 years. So instead of being these health practitioners caring for patients, healthcare systems have changed very much, especially in the last 20 years from the 2000s. So it is now seen as undesirable in healthcare to practice in isolation and may even put the patient at risk. So because of this change that has happened from caring to just health practitioners having more less care for the patients, so it is seen as undesirable for someone to practice their operation in what, in isolation, because in those days only one person could care. Like, you really care, it is your responsibility just to care about this person. It is yours responsibility. But that is seen as undesirable because you are living in isolation, and anything that gets to happen, it will be on you alone. So, the complexity of modern healthcare, which is evolving rapidly, acts as a driving force behind the transition of healthcare practitioners from being solonists to members of team who share a common aim. As the healthcare gets to develop, there is complexity that is coming in. The healthcare system is becoming more complex every time, but again, because there are a lot of things that are getting to happen, there are a lot of things that are getting to be introduced. So instead of something just being on one person, so healthcare practitioners now, from being soloists, soloists meaning just being able to work alone. Now there is a development of a multidisciplinary healthcare team. That is because things are now complex. It is very, very difficult for you to get to work alone. That is why there is need of a team. Why a team? That is because a team makes sure that you work for a common good. So today, as both clinicians and patients integrate new technologies into their management process, the overall rapidity of change in healthcare systems will continue to accelerate. There are a lot of things that are getting to happen, and you can't stay away from just getting to incorporate them. So even the changes in technology and the new things that are coming, patients and also health practitioners have to take into they have to accept the changes that are getting to happen. So even as you get to accept these changes, there is a rapid change in healthcare system, and this will continue to accelerate. So as these changes continue to accelerate, there is need for something to be done. So just in the US national guideline has listed over 2,700 clinical practice guidelines now. Like, this is what critical, like the clinical guidelines, over 2,700 have to be done. These are the guidelines to follow. And you see that this is something that is so cumbersome. And each year the result is of more than 25,000 new clinical trials are published. So there are a lot of trials which are being published of what is supposed to be done each year. So a lot of things are being developed, and that is like more cumbersome for people to be able to manage alone. That is why there is need for a multidisciplinary healthcare team. So no single practitioner can handle, absorb, and use all this information, like all these things that are getting to develop. Imagine you have got over 2,500 things that you have to know, and things that you have to understand, things that you have to practice. No single person can manage that. So that is why there is need for a multidisciplinary healthcare team. So each clinician relies upon information and action from other team members. Yet, without explicit knowledge and purposeful cultivation of the team, systematic inefficiencies and errors cannot be addressed and prevented. So, we're saying each clinician relies upon information and action from other team members. So, because of this cooperation, even if there is a lot of things to be known, a lot of things to be done, you are not just alone. You also rely on other team members. That is the importance. So you have to rely on other people. So if there is something that you cannot manage doing, that is why there is a lot of people together, so that you'll be able to make sure that you accomplish a common goal. Otherwise, there is a lot of emergence of a lot of new things that are getting to happen. Well, this is the basic definition, importance, and evolution about multidisciplinary healthcare team. Now, let's get to understand some characteristics. The development and characteristics of a successive healthcare team. So not just any healthcare team, but a successive healthcare team. So different types of teams can be identified in healthcare team. For example, there is what is called core teams. So what about core teams? So these core teams are directly involved in caring for patients. So are directly involved in patient caring or caring for patients. All right. So these usually consist of team leaders and members who are direct care providers such as nurses. So a core team can consist of nurses, dentists, pharmacists, doctors, assistants. They also include case managers. So these teams which are directly involved in the patient's caring, that is what we refer to as a core team. And then we also have coordinating teams. So what about coordinating teams? So the group responsible for operational management, coordinating functions, and also resource management for core teams. These are what we call coordination teams. So these we are saying they are responsible for. One thing that they are responsible for is operational management, to make sure that core teams get to operate. Are core teams able to work? Are doctors, nurses able to work? So these are there for operational management. Apart from that, also coordination of functions, getting to make sure that core teams are coordinated. They should be able to work. So these work in coordinating functions. Apart from this, for people to be able to work, where there is a group of people, for them to be able to work, there is also need for resource. So coordination teams are also involved in resource management. So these are basically the functions of a coordination team, to make sure that there is operation and also coordination, and also to make sure that there is resource management. These all get to look at the core team. These functions apply to a core team to make sure that a core team gets to operate, gets to coordinate, and also there is resource management for the core team. Apart from this, there is also a contingent team. So when we're talking about a contingent team, this is formed to deal with emergencies or specific events. So just emergencies and even specific roles. An example that we can, of course, these are not, they cannot always be there, but they are formed when there is an emergency that gets to happen, or where when there is a specific event that has to be done, or maybe they can be formed, but they will not be operating until such an emergency gets to happen. For example, when there is a cardiac arrest team or disaster response team. So these only get to happen when there is a disaster. They are not always happening because not every time do disasters get to happen. So apart from this, there is also ancillary team or services. So when we are talking about these are the group's support services that facilitate patient care, such as cleaners or domestic staff. So ancillary teams or services are simply those teams that are going to support services that facilitate patient care, okay, such as cleaning. So these support services which just get to facilitate patient care. So any team or group that is going to be involved in making sure that there is proper patient care, such as cleaners or even domestic staff. So those people who get to work, cleaners, domestic staff, those who make sure that the environment is clean, and just to make sure that there is no grass around. So those are what we call ancillary teams or services which are provided. Okay. So everyone basically is important for their specific role, and no one is above the other. So everyone gets to work to make sure that there is proper health delivery. Remember, it's a team, and a team works for a common good. So even if others have got bigger positions than others, they are all important for a common good. Now let's look at support services and administration. So what about support services and administration? So those who provide indirect task specific services in a healthcare facility support services. This is about support services and administration. So there are a lot of people provide indirect or task specific services in healthcare facilities, those support services. For example, there are people, they are task specific. Their aim is only to do this. That is what they are just there for. They have got a specific task, not having a lot of things to do. They provide also indirect services. So all those who are there for a task specific service or just an indirect service, they make sure that they support the services, and just supporting these services is important for proper and good health delivery. So it includes secretaries and the executive leadership of a unit or facility. So if you talk of just units or executives in a hospital, so those support just certain tasks. For example, getting to represent this group or getting to speak for this cause. So those support services, and they make sure that those services are delivered. So this kind of team has 24-hour accountability for the overall functioning of the organization. So they make sure that they work day and night to make sure that the overall function of the organization gets to happen. That is for support service and administration. These are administrators, so they are there to make sure that everything is getting to work. They are there for support services. Everything should be able to work, and it doesn't have to be only for a specific time. It is 24-hour service. So they make sure that everything is done. So in order for any team to form and develop in a way that makes it coherent, effective, and strong enough to face future challenges, research has shown that it usually passes through the following stages. So we want to talk about the stages that a team has to pass through to be effective. What are some of those stages that an effective team has to pass through? So the first one is forming. The second one is storming. And then we have got norming. So we need to understand each of these. Apart from norming, there is also performing. Okay. So what do each of these mean when it comes to stages of an effective team? For a team to be effective, what do these mean? So let's get to start with forming. So in forming, typically characterized by ambiguity and confusion, team members may be unclear about tasks at this stage. They have not yet chosen to work together and may communicate in a superficial and interpersonal manner. So at this stage, at the forming stage, like things are just getting to begin. So things might seem ambiguous, things might seem that difficult. There is ambiguity. And there is also confusion at this point. So because things are not yet settled at the forming stage, there can be also superficial and interpersonal manners. So superficial communication is also present at the forming stage. When we talk about superficial communication, this is a kind of communication that is not effective. Like people are not interested. People are not really interested in communicating, and there are also some interpersonal manners of communication which are not really good. So at this stage, basically things are not yet settled. Team members may be unclear about their task. You don't really know what you're supposed to do because you're just getting started. You don't have that much experience. So that is on the forming stage of an effective team. Now, when we come to storming, a difficult stage when there may be conflict between team members and some rebellion. So this is a difficult stage. There can be conflicts, there can be rebellions among team members. So, for example, when you get to task, you sup- dear, you are supposed to do this, and then the next person is supposed to do this. Other team members can rebel because of the task that they've been given. So that is on the storming stage, the very difficult stage of any team, where everyone is just getting, they just want to do what they want. If you ask them to do this, that is when everyone has been tasked to do this and this. They know about it, but they get to refuse to do it. So team members may get frustrated here when when do not progress when they do not progress well. Like, there is frustration if there is no progress. You've just started, you've just come from a point where you don't know what you're supposed to do, and now you know what you're supposed to do, and when you fail to achieve, frustration happens. So I was supposed to write achievement there. So frustration when no achievement is made. That is on the storming stage. There is conflict, rebellion, frustration when no achievement is made, and things just seem like they cannot work. There is no progress. So there is no progress. Frustration when there is no progress, when there's no achievement made. Now let's look at the norming stage. So at the norming stage here, there's open communication between team members is established, and the team starts to get to confront the task at hand. So now things start getting better. Open communication. So apart from this open communication, there is also, team members are, are established now. Okay. They are now getting familiar with the thing. They are getting familiar with what they are supposed to do. So team members are established, and at this point now they are able to confront situations. So they can be able to confront the task at hand instead of being able to fight. People now are aware of what they're supposed to do, and they confront what they're supposed to do. So generally accepted procedures and communication patterns are established. So procedures and communication patterns are established at this point, and things are now getting in control, other than on the forming stage where there was confusion and people are familiar about their tasks. Storming, where there are now conflicts because people do not want to perform. Now we come on the performing stage. So this performing stage, the team focuses all of its attention on achieving the goal. So they are now more concentrated. On the norming stage, there was just the starting of open communication, establishment of team members, and they are able to confront the task. Procedures have been established for operation. Now, on the performing stage, now team members can focus their attention on achieving a goal. They are now able to open and also trust, and also they are resourceful and effective. So that is on the performing stage. So the team is now close to each other. They are supportive. Apart from being supportive, there is openness, and also trust has started to develop instead of fighting. And then there is resourcefulness and also effectiveness. So that is on the performing stage. So after being formed and continue to develop, healthcare teams interact dynamically and have the common goal of delivering healthcare services to patients. So in order to succeed, the team members need to share certain characteristics. So these are the stages. Now, in order to develop, remember we've just been formed, there is a lot of confusion, and you are getting to develop, you are getting through the storming stage, norming stage, performing stage. Now, there are some characteristics that you have to develop as team members. So what are some of the characteristics that you have to develop as team members for operation to be successful? Of course, this is not just a mere team, it is a team of health professionals. So everyone can argue, everyone can go through that stage of misunderstanding. So some of the characteristics which are going to be developed at this time includes possession of specialized knowledge. So team members have got specialized knowledge. Everyone has got, they've got their certain expertise. There is something that they are able to do better that they were trained for. So there is possession of specialized knowledge and also skills. So these often function under high workload conditions. That is one characteristic that has to be possessed by a team. So possess specialized knowledge and also skill. Another thing is to know their role. So that is one important thing. You have to know your role. What have you to do in a team? What are you supposed to deliver? What are you supposed to be held responsible of? So know your role and the role of others, so that you not interfere with what another person is doing, unless if it is necessary for a cooperation to get to happen at that point. So you don't need to interfere with what others are supposed to do, but that doesn't mean you don't have to help. So just need to know your role and know the role of other team members, and also interact with one another to achieve a common goal. So there is also need for interaction, because what you are doing is a common goal. So of course, even if you know the role of others, doesn't mean you don't get to help them, because if one person gets to fail, everyone is going to fail because this is a team. And also act as a collective unit. This is one also important thing. You act as a collective unit. You are working together. So you act as one collective unit. Where one person fails, everyone is going to fail. So as a result of it, interdependence. So acting as a collective unit comes from being interdependent. Everyone depends on each other. Okay. Apart from this, you also need to possess specialized and complementary knowledge. So there is need to possess specialized and complementary knowledge. Well, apart from specialized, there is also complementary. What is going to complement your skill? What other thing do you know apart from just the region in which you are specialized? What else do you know that is going to make sure that you get to use it to achieve the goal of the team? So that is why we need to have that complementary knowledge. And after then, another characteristic is there is need for taking decisions. This is very, very important for a team. Decision making has to be there. So this is about a basic introduction of multidisciplinary uh, healthcare teams, the definition, the importance, the development, and also the characteristics of a successive healthcare team. Thank you so much for having been present. If this was helpful, please be sure to subscribe and also get to share. See you in the next video, where we're going to continue the values, principles, and benefits of a healthcare team.